All right, thank you everybody for coming this afternoon here today. My name is Deputy Chief Colin McAllister with the Naugatuck Police Department. Before we begin, I'd like to introduce several people who are with us here today. I have Naugatuck Police Chief Stephen Hunt, Waterbury State's Attorney Maureen Platt, Naugatuck Detective Sergeant Amanda Devon, Jennifer DeWitt of the Western Connecticut Coalition, Attorney Ferkelson from the Waterbury State's Attorney's Office, and Senator Logan and Detective O'Donnell from Naugatuck Police. We also have several of our community stakeholders in the room here today, including Beacon Health, Wellmore, Connecticut Counseling, MCCA, the Naugatuck Valley Health District, and Naugatuck Youth Services. We've called this meeting today to discuss the Naugatuck Police Department's latest efforts in tackling the ongoing opioid epidemic. The Borough of Naugatuck has not been immune to the impact of the opioid addiction in our community. To date, our community has experienced a total of 8 confirmed opioid-related overdose deaths, with 2 outstanding toxicology reports. We've deployed 22 Narcan deployments by our officers. We recognize that even 1 overdose is too many. These overdoses don't include the impact of property crimes on those who have stolen to support their habits, and the countless frayed family relationships that addiction leaves in its wake and tears at the very fabric of our communities. We think it's fitting that as September is National Recovery Month, we'll outline our ongoing efforts. Since Naugatuck Police Chief Stephen Hunt has assumed leadership of the Naugatuck Police Department in March of 2019, he has made tackling the opioid epidemic a priority for this agency. In quoting Archbishop Desmond Tutu, there comes a point where we need to stop just pulling people out of the river, and we need to go upstream and find out why they're falling in. The Naugatuck Police Department has committed to a 3-prong approach of tackling the opioid problem. The first being education, which is we've reintroduced DARE education into our school system. Furthermore, we have expanded our school resource officer program beyond the high school by deploying another officer in our intermediate school. We've also introduced community-wide Narcan training to get this life-saving drug into the hands of more community members in hopes of reversing overdoses before they become fatal. In the enforcement aspect, the Naugatuck Police Department has affirmed its commitment to enforcement of opioid problem at the distribution and dealer level by partnering with the Drug Enforcement Administration and assigning a detective to work full-time with our federal partners. We also plan to assign a detective to the statewide narcotics task force under the Connecticut State Police to further target opioid sales and distribution in the region. In addition to prevention, the newest addition to our program will be police-assisted addiction recovery initiative called the PARRI program. This program, which we formally launched as of September 1st, 2019, will be the first of its kind in the region. The Naugatuck Police Department will begin by querying our data on fatal overdoses and overdose reversals. Armed with that data, we'll follow up to the overdose victims and their household members with one of our partner agencies' recovery coaches and a detective assigned to this program. The partnership will encourage overdose victims and the household members to utilize services to encourage treatment, recovery, and harm reduction strategies to prevent further overdoses. Additionally, our officers will be trained and community members advised that if anyone wishes to seek treatment, our officers will ensure a warm handoff to a recovery coach through a partnership with St. Mary's Hospital. The recovery coach and our team of officers will communicate with the state's attorney's office to ensure they are apprised of any persons enrolled in recovery-related programs for possible consideration during their judicial proceedings. We recognize that it's only through collaboration and partnership that we can begin to curb the opioid epidemic. While this program is unique and untested, we owe it to our community to utilize all of our resources at our disposal to help reverse the scourge of opioids in our communities. I'd just like to summarize the key points that I've gone over here. Education, enforcement, and prevention are the key components of this strategy. With that said, I'd like to turn this over to Chief Stephen Hunt, who has several comments.
Thank you, Deputy Chief McAllister. I would just like to take a minute to thank all of you for being here this afternoon. Mayor Pete Hess could not attend due to an unforeseen conference call he had down at Town Hall, but he would have liked to have been here. And also Dr. Peter Jacoby from St. Mary's Hospital was supposed to be in attendance. Unfortunately, the emergency department is too busy right now for him to get away and attend our press conference. So I just wanted to point out that they were supposed to be here. When I became chief 6 months ago, as Deputy Chief McAllister has already stated, I met with Mayor Hess to determine our priorities for our department as we move forward. We both agreed that our top priority would be to address the opioid epidemic. And as Deputy Chief McAllister has already stated, we're launching a three-pronged approach to this problem: education, enforcement, and prevention. With the cooperation of School Superintendent Sharon Locke, we have reestablished the DARE program at City Hill Middle School. The PARRI program, or Police Assisted Addiction and Recovery Initiative, which we have outlined today, addresses our prevention component. And for enforcement, I am here today to send a clear message to anyone selling drugs in our community. Working with our partners in the state police, the DEA, and the Waterbury State's Attorney's Office, we are going to conduct thorough investigations, identify the suppliers of this poison, and arrest anyone that is involved with its distribution in our community. I would like to take a moment to thank State's Attorney Maureen Platt for being here. Her unwavering support and vital input into developing this program has been just phenomenal. Can't say enough about Maureen and her staff. I'd like to thank Jen DeWitt from our Coalition Against Substance Abuse for helping us to develop this program. We couldn't have done it without Jennifer. She's been an integral part in this entire process as we came up with our three-pronged approach. Dr. Jacoby, who isn't here in St. Mary's Hospital, we can't thank them enough for stepping up and partnering with us to provide services in their emergency department when it's needed. And to our friends at Wellmore, MCCA, and the Connecticut Counseling Center for partnering with us to provide recovery coaches to go out with our detectives into the community to provide the necessary resources to make this program work. Obviously, we couldn't do it without them. Thank you to Step Up Naughty of Naugatuck Youth Services for their partnership throughout this endeavor to establish these programs. They're our local prevention council. They're here with the orange shirts on and the blue shirts, and they're up here in the front. I can't say enough about the work they do in our community, and their friendship and cooperation with us is just vital to the program. And last but certainly not least, I'll wrap it up by thanking Mayor Hess, our Board of Police Commissioners, our Burgesses, Senator Logan, and Representative Rabimbus for their support of our department, which has always been unwavering as we tackle this opioid epidemic head-on. Thank you.
At this time, I'd like to turn this over to State's Attorney Platt for several comments.
First of all, I would like to commend the Naugatuck Police Department for this innovative approach to stem the absolutely horrible and epidemic opioid crisis that every community in the state of Connecticut is experiencing. I have no doubt that this program will become a model for every community in the state. Chief Hunt, Deputy Chief, and the staff at the Naugatuck Police Department have amassed a great deal of information and experience to come up with the program that's being presented to you today. And I have 100% confidence that this program is going to save lives. As we all know, no one approach is going to stem the opioid addiction. We must come at this from every single angle and treat it with the seriousness that it deserves. About 100 people a year may die of the flu in this state. That's a horrible number. The Office of the Chief Medical Examiner projects that 1,100 people will die from opioid addiction this year alone in the state of Connecticut. And unfortunately, that number is up from prior years. We must act, and we must act with the sense of urgency that this crisis deserves. My office is 100% committed to participating and supporting this program. In the audience today is Ann Taylor from our staff, who is a social worker who is embedded in our office. Ann will also, through our early intervention program, which is a specialized program to divert people out of the penalty phase of the criminal justice system and into the treatment phase, intends to support this program 100%. She can do things like providing bus passes for people to get to treatment, helping people find locations to live if they're homeless, and basically supporting this program. I am 100% confident that this program is going to make a difference, and as we do on every other issue, Chief Hunt and I will be in very close and direct contact about how the program is working and how we might fine-tune it so that lives can be saved here and lives can be saved throughout the state. Thank you.
Okay, next, I'd like to ask Jennifer DeWitt, a Behavioral Health Director of the Western Connecticut Coalition, to speak. Jennifer's been integral since the beginning and planning stage of this program, so it's only fitting that she speaks up here.
Thank you. Good morning. I just wanted to thank, or actually good afternoon, I want to thank all of the partners that are here today who've already been mentioned, many of whom are on the Greater Waterbury Area Opioid Abuse Prevention Work Group. We are a group of treatment providers, prevention professionals, youth service bureaus, public health districts, people with lived experience, and families and friends of people in recovery who come together to try to brainstorm and figure out all the different ways that we can crack this nut that is the opioid crisis. And so it is through that partnership and through that relationship and that work group that many of the providers that are here today and that are part of Naugatuck Police Department's PARRI initiative were able to sign MOUs and formalize the relationships to work together to address this crisis. As State's Attorney Platt said, it takes multiple strategies working from multiple sectors of the community, and I think that one of the most important things that Naugatuck Police Department is doing is this initiative is role modeling relationship building within the community. A police department's first responsibility is to keep the community and the public safe, and then beyond that is relationship building and community education, and the department has done nothing short of go above and beyond their role to do that by hosting Narcan training here at the beginning of the summer, where we're in this very room. It was a packed audience, continuing to provide that education and training, and through Mayor Hess, all town employees are going to be trained in the opioid crisis in the use of Narcan. Naugatuck Youth Services has been an integral partner in providing mental health first aid training so that regular folks in the community can understand what a substance use disorder looks like and how to connect and intervene when someone's experiencing an addiction-related crisis or an overdose. And then, the ongoing partnerships that happen afterwards. So after there's an overdose, having the relationship with Detective O'Donnell to be able to go back out to families and to residences and say, how can we help? Has your loved one been offered treatment services? Are you trained in the use of Narcan? Do you need any support? And here's a packet of information to tell you where and how you can get that support. I just think that you guys are jet setters, and I'm so very grateful to have the opportunity to work with everyone in this room. So I can't wait to see what good things happen as a result of this initiative, and thank you everyone for being partners. We can't do it without you.
I don't have a prepared speech, but what I want to say is that when you take a look at Connecticut and this opioid epidemic, it's one that is stretched throughout all of our towns. I represent 7 of the 169 towns in our community, and each and every one of them is struggling with this issue. This is a team effort, a community effort, and I love the initiative that we have here, looking at it in terms of education. Education starts at home, starts with our children, to make sure that as our kids are growing up that they understand what this addiction can do to their lives. Enforcement. We need to work with our law enforcement who have the reach throughout every corner of our community. It's so important. And then when it comes to treatment, in terms of working with the state, making sure that the state understands that we need to prioritize treatment programs, treatment services, so that we can help folks that are addicted, so that we can try to stop this seemingly never-ending cycle. Working with Mayor Pete Hess, Deputy Mayor Lori Taft Jackson, many discussions on ways that we can try to improve and help the situation through our community. And I am definitely here to do whatever I can to help this very innovative program. And we need to look at ways, different ways, to come at this disease, this addiction, this epidemic that is finding whatever crook and cranny they can to get to the good people of our community and the good people in our state of Connecticut. And we've got to fight this with everything that we have. So thank you.
All right, at this time, I'd like to open up the floor to several questions. I may direct them over to people who, in their respective fields, maybe would better answer them than myself. So, Elio,
Could you walk me through, I guess, how the program would work? How does somebody get into it? What are their steps? I guess walk me through, like, if I overdose, what would you guys do for me?
all right, so that's going to begin with communication between our patrol officers out in the field, and they're going to record that there's been a Narcan deployment. Within 2 weeks, the record of that incident is going to be forwarded up to our detectives, who are going to coordinate with our partner agencies here and the detective assigned to the program, and they're going to try to establish contact with, ideally, the overdose victim. Realizing in some circumstances this may be an overdose that was fatal, at minimum household members, because we know that there is a high risk for household members also having substance use issues. At that time, we're going to try to make contact with the household members and the victim and offer them services with the specialization of the recovery coaches, which these agencies have given them. The officer is simply there to make an introduction, to offer any services or support. But ultimately, the behavioral health component and the clinician is going to have to take the lead with this. And that introduction and trying to make that partnership between the two is what our role in this is going to be. Do you have any other questions?
Yeah, I got a couple of them.
Oh, go ahead, Elio. Yeah.
You mentioned a partnership with St. Mary's. What's the partnership with St. Mary's for emergency services, or?
So addiction recovery coaches are especially trained part of this field, and currently St. Mary's Hospital is the only hospital in our region which has access to a recovery coach. So it comes to ensuring that our officers, should we have an after-hours request for services, know that they can direct the victim or the person requesting services to the appropriate medical facility. So in speaking with Dr. Jacoby and St. Mary's Hospital, we're able to ensure that they're on board with 24-hour access to anybody in our community who seeks those services after hours. We understand that sometimes people will come forward and request help outside of normal business hours or outside of the time that we've partnered with these agencies, which will be several times a month.
And then how does this differ from past practice? How is this, I guess, new?
This program is unique for us. It differs from previous programs. There are several in the state of Connecticut that focus more on people who may enter the police department and request services, roadside contact with or police-initiated contact where people may request a deferral of an arrest in lieu of treatment. That's what's different about this, is there's a really self-initiated in terms of that we're going to take this forward to the people who we deem to be most at risk for an overdose, those who already have overdosed or those who are in a household with somebody. And this is modeled after several programs that we found in Massachusetts, but we're not aware of any with the actual follow-up for the overdoses in our region specifically. So we feel that this is a unique program and that it may be a model and it may be something that can help make a difference.